Good day, my dear friends and colleagues. Today our appointment number 17 with new radiological anatomy. Today I want to talk about the Chamberlain Line. Chamberlain Lines is different from these Liverpool football players which is also have the same name, Chamberlain. So only I put the image of him to remember the name, Chamberlain Line. This is my presentation today. What is the Chamberlain Line? Chamberlain Line is a line extending or connecting between the posterior margin of the hard palate, like this red line, and Episode-17, which is the most lower and inner margin of the occipital bone. So this line is very important line, and this is the definition of the line. What is the importance of this line? I will discuss it in the next slide. Okay, Chamberlain line like this line, white line, which extending from this point to that point. And this image is the unenhanced sagittal reformat image of the CT in the bone window. Let's announce some or label some anatomical area in that image. The sphenoid sinus appearing here in the most upper portion of the film, and the bone under the sphenoid sinus is called the clivus bone, and the most posterior edge of this bone is called the dorsum celli. And this bone, which is triangular shape, is the clivus bone, which abutting the posterior and lower surface of the sphenoid bone or sphenoid sinus. And then these lines is referring to the most inferior portions of the dorsum celli, which is called the basion. The basion is forming the anterior aspect of the foramen magnum. This one is the foramen magnum. So the basion is representing the anterior margins of it. The hard palate appearing here at the anterior aspect of the film, and the most posterior portion of the hard palate representing the first point of the Chamberlain line. Then the occipital bone, this is the most bony structure appearing at the upper part of the film, and the Episode is representing the most inner aspect of the lower portion of that bone, occipital bone. So now the Chamberlain lines is the lines connecting between the posterior edge of the hard palate and the Episode, which is representing the most inner and inferior part of the occipital bone, which is forming the foramen magnum with the basion. And the basion is the most lower aspect of the inner and lower aspect of the clivus bone or the dorsum celli. And now this is the cervical spine. We can count it by the C2, which have dense or elongated posterior top, elongated area in the top like this, and C3, C4. And this is the anterior bony structure. This is representing the anterior arch of the C1. The top of the C2 is called the dens, and this is the dome of the dens of the C2 cervical spine or axis. Anterior arch of C1, which also have another name is atlas, is represented by this bony segment, and there are atlantoaxial joint here between the atlas and the axis, which representing C1 and C2. This is some anatomical structures which are related to Chamberlain line. So what is the definition of Chamberlain line? Is a line joining the back of the hard palate, as I described in details in the previous slides, with the Episode, which is the most lower aspect of the occipital bone and the inner portion of it. A lateral view of the craniocervical junctions, on the lateral view of the craniocervical junction. And the red one is representing the C2 or the axis, and this is the significance or importance of the Chamberlain line, which make relations between the dens of the C2 and that line. Again, Chamberlain lines is represented by this yellow line in this time in this sagittal T2 MRI examinations, also between the same points of the posterior edge of the hard palate and opisthion here. However, here the dens, as we see, is projecting superior to that line, and this is a significant of Chamberlain line. It helps to recognize basilar invagination. This one is called basilar invagination when the dens is projected above the Chamberlain line. And this is the tip, which is colored now, and it can be discriminated or recognized it clearly as above that line, Chamberlain line. And there are landmark which is 3 millimeters. The tip of the dens is more than 3 millimeter above that lines to consider it as a basilar invagination. Normally it is below the line. However, if it is above, you should measure by millimeters to be more accurate in diagnosing of the basilar invagination. So this yellow segment is if more than 3 millimeters is considered as a basilar invagination. And now with another line also extending from the posterior edge of the hard palate, but this time at the most lower bony part of the occipital bone, not the inner margin. If only we cannot detect this opisthion, we can measure this line as a landmark of the basilar invaginations, and at that time is called McGruger line, not Chamberlain line. So the McGruger line, green one, refers to a line connecting posterior edge of the hard palate to the most caudal point of the occipital curve. Is a modification of the Chamberlain line. Only use it when you cannot detect the Chamberlain line or difficult to measure or draw the Chamberlain lines. Use the McGruger line. It is a modification of Chamberlain line and is used in the evaluation of the basilar invagination when the opisthion is not identified on plain radiograph. And now this image is unenhanced, also CT, sagittary format, however in the brain window at that time. I want to talk in this image about this yellow line. Yellow line here is another name is McGruger line. McGruger line is connections between the basion, which is most lower part from the dorsum celli of the clivus, and the opisthion, which is the most inner and lower part of the occipital bone. So basion, this point, as I described before, and opisthion, this point, which are referring to the foramen magnum opening. This is the basion and the opisthion connecting by that yellow line, which is called the McGruger line. And also anteriorly, we can discriminate the hard palate here, even in this soft tissue, better to be detected in the bone window. However, anterior pituitary gland also can be detected here within the sella turcica, and this is the sella turcica part from the clivus and dorsum celli and sphenoid bone here anteriorly. And this is the clivus as I described it before. So McGruger line is the line connecting between the basion and opisthion and referring to the foramen magnum. This part is the cerebellum, which is the posterior fossa of the brain, and anterior to it is the fourth ventricle and the brainstem. The most bulging part anteriorly is the bones from the brainstem. So this is the cerebellum, and this is the cerebellar tonsils, and this line is drawn to detect the cerebellar tonsillar lesions or ectopia of descent of this tonsillar part from the cerebellum. So the definition of McGruger lines is the radiographic line that connects the anterior and posterior margin of the foramen magnum basion to opisthion. and it can help us to measure the cerebellar tonsillar positions. Normal is above the foramen magnum. The cerebellar tonsils normally above the foramen magnum or above the McGruger line. However, if it is detected below that line, we can consider it a grade from the tonsillar herniations or Chiari malformation. To summarize these, we have three lines: the McGruger line, which connecting the Pisiun to Opisiun and referring to the foramen magnum; McGruger line, the green one, which connecting the posterior edge of the hard palate and the most lower part of the occipital bone; and purple one, Chamberlain line, our presentation talk between the posterior edge of the hard palate and the opisthion, which is the most inner part from the occipital bone. And this is the three lines which can be used to diagnose or confirm diagnosing of the basilar invagination. And now, to diagnose the basilar invagination, basilar invaginations can be diagnosed through measuring any one from this line. The first line is the Chamberlain line, if the tip is more than 3 mm above the line, and the McGruger line, if the tip is more than 5 mm above the line. However, McGruger lines and relation for diagnosing of basilar invagination. McGruger lines, as we see here, the yellow one. So the tip of odontoid process, if crosses these lines by any millimeter, it considers a basilar invagination. Causes of the basilar invaginations. What is the diseases which related with the basilar invaginations or resulting in these basilar invaginations? The diseases is classified into congenital and acquired. The congenital causes is referred as an invaginations. And invaginations referred to normal bone of the foramen magnum. There are no softening of the bone of the foramen magnum. However, the causes of these congenital, which can cause basilar invaginations, is the osteogenesis imperfecta, Klippel-Feil syndrome, achondroplasia, Chiari-1 malformations or Chiari-2, cleidocranial dystosis. This is congenital causes, and these lesions are associated with no softening of the bone of foramen magnum, so it is called basilar invagination. However, the acquired cause of the basilar invaginations is better to describe it as an impression, not invaginations. And impression meaning there are abnormality of the bone of the foramen magnum, softening of these bone, resulting in that descriptions as a basilar impressions rather than basilar invaginations. And this occurs with the acquired causes. The most common acquired cause is the rheumatoid arthritis. However, Paget's disease, hyperparathyroidism, and osteomalacia rickets also can resulting in basilar impressions or softening of the bone of foramen magnum, plus elevations of the density of the C2 above the previously described line, like Chamberlain line, which is the main line for this diagnosis. And this is again to confirm or summarize the lines. The McGruger line, yellow one, and the purple one is the Chamberlain line, and the green one is the McGruger line. And now with two cases practice only to differentiate between the congenital and acquired cause. As we see here in this sagittal T2 weighted image MRI, we can see there are invaginations of the density of the C2 above the level of the lines previously described. This one is the Chamberlain line. And if you look closely to the foramen magnum bone, there are no softening of the bone. So this one from the basilar invagination, from the congenital cause or called basilar invagination. Actually, this was a case of osteogenesis imperfecta associated with basilar invagination, as we described before how to diagnose. And now with the second practical case, this is actually the lateral radiograph of the cervical spine, which is showing degenerative changes, and also the Chamberlain line, which extending from the posterior edge of the hard palate until the opisthion or the most lower part of the and the inner part of the occipital bone. It shows also abnormality of the dens which extending above this line, and these findings in the X-ray is the finding for the basilar invagination. MRI for the same patient showing an abnormality of the dens which also extending above the Chamberlain line, which extending from the posterior part of the hard palate until the opisthion, and also we can notice the softening of the bone here, and this softening of the bone can considered as an acquired cause for these basilar invaginations, and if you consider it as bone softening and acquired cause, you can describe it as a basilar impression rather than basilar invagination. So the case is the case of basilar impression due to an acquired cause, and this cause was a rheumatoid arthritis for that patient. I hope this lesson has helped to make a few things clearer for you, and if you have any questions or query or suggestions for a new presentations, you can pop it in the comments under the video, and you can also invite it in the Facebook group by the same name, is and different radiology, and you can also watch more than 90 presentations in my YouTube channels by searching in Google search by the same name of channels, is and different radiology. At the end, I with you also every Wednesday, Sunday, like this Sunday and Friday, for new lessons MRI, rapid review anatomy, and mnemonic word respectively. Thank you very much for your watching, and have a nice day.